محمد وآل محمد صلوات.
اللهم صل على محمد وآل محمد.
Thank you once again, brothers and sisters, for joining us for our weekly Friday night program. Alhamdulillah, it's great to see so many faces here. Each week, as we've discussed, our goal is to discuss a topic of great relevance to especially the youth, the communities here. This week, one of our topics, it's a very pressing topic, but unfortunately a topic that's not discussed much, is addressing our mental, emotional, and spiritual health. We're honored to have amongst us a sister from our community who's driven all the way from Salisbury to be with us tonight, Sister Anisa Diab. She herself is a suicide prevention counselor and has quite a bit of experience in counseling with youth facing issues with depression, emotional instability, and the like. And we've asked her to join us, and we're so grateful that she accepted our invitation to join us here to give us some insight on how our youth and all of us can be emotionally and mentally sound in our health. After her, we'll have some question and answer, and also Sheikh Jalil will share some thoughts as well. So with that, I'd like to invite Sister Anisa to the podium. Please welcome her with a loud salawat.
اللهم صل على محمد وآل محمد.
Bismillahirrahmanirrahim. Assalamu alaikum, everybody. I'm really honored to be here, and I'm so thankful to be able to be given the opportunity to talk about this really important subject of mental health. Hopefully everyone can hear me okay. If you're having trouble hearing me, okay. Thank you. How's this? Good? Okay. So the topic that I'm talking about tonight is all about understanding mental health. And as you know, Brother Azmat said, I work at Salisbury University and I work in their counseling center. The work that I'm doing right now is mostly prevention work related to suicide. And just to give you a little bit about my educational background, I did my bachelor's at Salisbury University in psychology, then went on to get my master's at University of Scranton, Pennsylvania, in community counseling, became licensed, so I'm an LGPC. And the second reason why I specifically got into suicide prevention work is because really suicide prevention is about saving a life, right? And in the Quran it says to save one life is as if you've saved all of humanity. And each and every one of us in this room has an opportunity to help save a life, to know the warning signs, and prevent suicide from happening in their communities. So I wanted to be a part of that mission, and it's been, alhamdulillah, a very, very rewarding experience for me. And also the third reason I got into this line of work is because I saw that there was a lack of Muslim mental health professionals, and I saw this as a problem. So I would encourage any of the youth here today to get into that line of work. It's not an easy job, but it's a very rewarding job because you really are making a difference in a meaningful way. So that's just my little introduction into that. Okay, so let's talk a bit about the trends that we're seeing currently when it comes to mental health in the Muslim community. So some common things that we're seeing are issues with identity crisis. This is nothing new, especially after 9/11 and in the political environment that we're seeing. People are struggling with their identity. Do they assimilate? Do they keep their Islamic identity? How do they balance those two things? We also see adjustment issues. This is particularly true in our immigrant population who are coming to this country for the first time, struggling with things like culture shock, things not being the same as they are back home, dealing with those kinds of stresses. Depression, anxiety, and suicide are big ones as well that we're seeing. And I'm going to talk more in depth about those because I think those things lead a lot to these other things. So we've also got substance abuse. Unfortunately, becoming a growing issue, which, we really wouldn't expect because, we know drinking is haram, it's forbidden in the Quran, and so is, drug use. But, unfortunately, more and more youth are getting caught up with alcohol and other substances. So that's something to keep an eye on and be aware of. Eating disorders is another issue. Personality disorders, obsessive compulsive disorders. And really, anybody can struggle with a mental health issue and any kind of mental illness. So this is not a conclusive list, but these are just some of the things that we're seeing more and more of. And I'm not going to talk to you about each one of these and define them because you can go do that on your own, look it up and learn more about those things. But what I do want to talk to you about is how we can help people who are struggling with mental health issues, and how can you help yourself too if you're struggling with something. Am I clicking? Okay. The other point that I want to make is that mental health is a really complex issue, okay? So we're talking about feelings like stress, grief, anxiety, frustration, shame. And it's different when we're talking about somatic issues or physical issues, because I'm going to give this example quite a bit, but somebody who has a broken leg, you can point to that broken leg. You can see it. I can see a tumor. I can point to that. When it comes to mental health, you can't hold that in your hand. You can't hold depression. You can't touch anxiety. You can't see it. It's not something tangible, which makes it an even more complex issue, that we're talking about something you can't really see. And so you really have to read between the lines and notice when somebody's giving off signs that something isn't right, okay? So mental health is a complex issue, but we can certainly know some of the warning signs to help us understand it better. So some of you probably heard about this, maybe some of you haven't, but suicide is becoming a big issue in Muslim communities, unfortunately. And pictured up here on the left is a young woman named Sirhan, and she committed suicide back in June. She actually had 2 children, had a 3rd one on the way, and she shot herself. And this young woman on the bottom too, Asiya, she also killed herself, committed suicide. And as you know, Dearborn is a highly populated Muslim community. So it's interesting, they noted in their report that Sirhan's death was the 4th reported suicide in the past 6 months in Dearborn. 4 suicides in 6 months. So we've got to ask ourselves, what's going on here? I mean, why is this happening to our youth? I mean, Sirhan looks like somebody I would see on the street, any sister who would come to the masjid, somebody who would be in my class with me. I mean, it's hard to fathom why this is happening. So it's really important for us to realize we can help prevent people from committing suicide. We can help prevent this from happening. And we're going to talk more about why some of these things are happening during the presentation. Okay, so let's talk about stigma, all right? One reason that people do not get treatment, do not seek help, is because of the stigma associated with getting mental health treatment and having a mental health issue in general. So stigma are those negative perceptions that cause people to do things like label. So we don't want to be, labeling people, defining people by their disorder, saying, oh, she's psycho or he's OCD. For somebody struggling with a mental health issue, once you label them, you're starting to stigmatize that person. And we need to understand that people who struggle with mental health issues lead very successful lives. They are capable of holding down jobs. You, I'm sure, have known somebody that has a mental health issue, and maybe you didn't know it, but they're your average everyday people that you come across. So it's important to realize that too. And another thing that results with stigma is these attitudes that people have towards help seeking. So one of the attitudes is that going to see a counselor, going to see a therapist means that I'm crazy, means that there's something wrong with me, that I'm weak, that I can't handle it on my own. And this is a problematic attitude because that's what prevents people from getting help. We all need help at some point in our lives because we all have different challenges. So, stigma plays a big role, and in stigma, we don't know Sirhan's story, but I would imagine that stigma was part of that story and how she possibly committed suicide. So let's talk about signs in general for mental health issues. So some of the signs that we're looking at are poor academic performance, somebody who's missing class a lot, someone who has some mood changes, so they might be depressed, seem to not really care anymore, irritated. Another big one is change in appearance, so maybe even not showering, just not taking care of themselves could be a sign of a mental health issue. Disrupted or excessive sleeping. So sometimes parents think, oh, he's just sleeping, it's normal, being a normal kid, he takes naps all the time, it's just normal, he's tired. Sometimes that's a sign of depression. So you need to look into that. Excessive dependency on others is a big one. In our community, just the use of substances like alcohol or drugs would be an issue. Disturbed speech, and of course it goes without saying, people who are having suicidal thoughts or homicidal threats, meaning they're talking about wanting to kill other people. Those are all signs of some psychological distress. So let's talk about stress, all right? Stress is a major trigger for a lot of mental health issues, so it's really important to understand stress and to be able to take care of yourself when you're starting to feel stressed. Stress is something, alhamdulillah, Allah has given us for a good reason. Stress is what helps us when there's a lion behind us chasing after us that causes us to run and gets our adrenaline running, when we're driving a car and somebody speeds in front of us and we have to hit the brake. Stress is really good in those situations because it helps us react right away. The problem is some people can't turn off that stress. Sometimes that stress is just constant, and that's when stress becomes anxiety, and that's when it can be a problem. So anxiety becomes a problem when it's more severe, when it's long-lasting, when it's affecting your functioning, okay, your work, your relationships, and that's pretty much goes with any mental health issue. When something's beginning to affect your functioning, that's a sign that something's wrong. And oftentimes anxiety will co-occur with other things, such as depression or substance abuse. It'll cause you to avoid certain situations, obsessive or compulsive behavior. So sometimes a person will have to check that the door is locked to their house 20 times to make sure that it's locked. That's an example of an obsessive compulsive behavior. Panic attacks is another thing. So sometimes people get so stressed, so anxious, that they almost feel like they're dying. So they'll have shortness of breath, palms are sweaty, heart is racing, and that's a pretty big sign if somebody has panic attacks that there might be, a disorder. And then self-injurious behavior. So sometimes, people try to adapt to certain situations by injuring themselves, by cutting. So that's another big indicator. Another thing I want to talk about is depression, because that's a common issue. It's one that I see among college students a lot. And I think sometimes people have trouble understanding between depression and being sad, because that word is used so much. People just say, oh, I'm so depressed, I didn't do well in my exam. Okay, well, what does that mean? What do you mean by depression? So when we're talking about depression, we're talking about clinical depression here. And the difference between clinical depression and just being sad involves the following symptoms that we're going to talk about here. So first of all, there's a persistent feeling of sadness, and it doesn't really go away. So it lasts at least 2 weeks or more. Another big symptom is loss of interest in usual activities. So let's let's say somebody really enjoys coming out to this youth group and being a part of the masjid, and you notice that they haven't been here for weeks and weeks and weeks. That could be a sign that that person is depressed. Of course, you wouldn't know unless you reach out to that person, right? But that could be a sign. Or somebody has a passion for soccer and they stop playing soccer. And that's weird. You love doing that. Why did you stop? So that's an indication that, could be more than just sadness. And then there's the following symptoms down here. So changes in appetite, oversleeping, maybe not really getting to sleep at all, increased fatigue, loss of energy. So sometimes people can't even get out of bed in the morning. And they want to get out of bed, but they can't. Feeling restless, irritable, difficulty thinking, concentrating. So I think, you can use your intuition. You don't have to be a counselor. You don't have to memorize all this and diagnose somebody, but you can use your intuition and recognize when something's not right, when somebody seems to be, just not involved as they used to be in things. You can get a feel for that. So that's the major difference between just clinical depression and sadness. Okay, so let's talk a bit about the warning signs of suicide. So a good acronym to memorize the warning signs of suicide is path warm. Okay, so ideation, substance abuse. I'm not going to read it all to you, but the big ones to remember here that research talks a lot about and that I've heard a lot anecdotally even is first of all the ideation. So threatened or communicated ideation. They're talking about wanting to commit suicide. They're talking about dying a lot. That's a big sign, obviously. Hopelessness is also a very big one. So just not really seeing, a way out of their situation, feeling like things are not going to get better. That's a big sign as well. Withdrawal, so withdrawing from family, withdrawing from friends, isolating oneself is another big sign. And then recklessness even. So I'll give you an example of that. One man talked about his daughter who had committed suicide about 2 weeks before she committed suicide. They went on a trip to the Caribbean. And on that trip, they were swimming with sharks. And of course, you don't want to get up too close to a shark, for many reasons, but this young woman she said, was swimming with those sharks like she was swimming with goldfish. 2 weeks later, she committed suicide. So that was an example of something reckless, something impulsive. It might even be just driving quickly, or especially if somebody's not usually impulsive type of person, seeing them act recklessly can be a sign that there's an issue there. So good things to keep in mind. There's also comments that people will say that could reveal that they're suicidal. So everyone would be better off without me if I were dead is one of them. Sometimes I just can't take it anymore. Things won't ever get better. What's the point of living? It's important to keep in mind as well that a person might say these things and be smiling. A person might say this kind of statement and say it in a way that's joking. And I think that's important to realize is that a lot of people also mask how they're feeling. And so you want to stop and really listen to that statement and listen to what someone's saying. And anytime you hear a statement like this, you're hearing what we talked about earlier about the feeling of hopelessness. About the feeling of things not getting better, feeling trapped that we talked about. So, you want to be direct with that person in that situation and say, are you talking about suicide? I know you're laughing right now, but I'm a little worried about you. I'm worried about you, and really explore what they mean by that, okay? So, I think that one of the things that gives me a lot of hope too, and I think should give all of you a lot of hope, is even though we're talking about something that's very sad and somber, and is that there's a lot of hope that suicide can be prevented, okay? Because what we know is that people with suicidal ideation, 90% of them have a mental health disorder that's diagnosable. And most of the time it's depression, And if it's not depression, it's another diagnosable mental health issue. So really, most of the time when you see people committing suicide, it's because they have a mental health issue. Okay, there's 10% that I guess don't fit that category, but most of them, have that issue. So what we also know is that 80 to 90% of people with depression respond effectively to treatment. So that means if we can get these people connected to the right resources and reach out, we can help prevent suicide. So let's talk about how you can help. So first thing you want to do, obviously, is you want to offer your support, right? You want to express your concern. Sometimes this is not easy. Sometimes you might not even know that person. Maybe you're meeting this person for the first time, but you just notice that something's not right. Still, go up to that person, connect with them. Express your concern. Say, I notice that you seem really down lately. That's not you. What's going on? I notice you don't seem yourself lately. Do you want to talk about something? And just listen. And really listen. I mean, actively listening. I put this picture up here, bro, that's haram, because it's easy to be shocked, right? So if somebody says, yeah, I have been feeling kind of down lately, I've been kind of depressed, and I'm actually, kind of thinking about suicide. Right? You do not want to be shocked and say, oh, that's haram, because what you've just done there is you've just shut the person up. You've just shut that person down from wanting to share more. And what you want to do is listen to that person and validate that, wow, that's got to be difficult that you feel that way. How can we help you? Okay? So you want to urge that person to seek out resources once you've listened to them, understood where they're coming from, why they're thinking about these suicide. Maybe they're not having suicidal thoughts, but just even understanding what's going on in their life can really help somebody. Okay, sometimes people just need that validation and that support. So let's talk about some resources. Most of these you probably know, but we're going to talk a little more in depth about it. So if you're a high school student, elementary school student, you can see a guidance counselor can help you and support your friend. I work in a college counseling center. We have licensed social workers, licensed counselors, a licensed psychologist, and the great thing about it is it's free. So if you're in college, you get free counseling. So I say take advantage of that service. And then there's also community mental health clinics, which also have social workers, psychologists, counselors, probably even a psychiatrist. Local health department is also a good place to look for mental health resources. And a lot of times these local health departments will even have support groups that are free. So for example, our local health department has a survivors of suicide support group. So you can look on their website, see what kinds of resources they have. But really you're looking, when you're dealing with a mental health issue, you're looking for a social worker, preferably licensed, okay, licensed social worker, psychologist, counselor. They basically all do the same type of work. They just have different educational backgrounds, okay? Psychiatrist is different because a psychiatrist prescribes medication, okay? So even if you start out, or you're a person in distress starts out with one of these others, like a counselor, a psychologist, social worker, they can refer that person out to a psychiatrist. So really, it's just about getting in with somebody. It's whatever you choose or whatever that person chooses, their preference. And of course, I think telling your doctor is a good idea. Definitely a good idea. Another thing I want to talk about is the Suicide Prevention Lifeline. So this is, I think, a really good hotline to leave somebody with, because sometimes, people are reluctant to go to counseling, but at least you can leave them with something. And this hotline is really great, because no matter what state you are in the U.S., whether you're in Wisconsin or Florida or Maine, you call this 1-800-273-TALK, you're immediately connected with a crisis worker in the nearest place that you're in. And that crisis worker will evaluate what's going on, assess what's going on with you. It might not be suicidal ideation, you might just need a referral. for a mental health practitioner. They can help you with that. You might just be having a bad day and need somebody to talk to. That's the person on the other line to listen to you and help you out. But if you are, or somebody you know is suicidal, what happens is the crisis worker answers the phone, they do an assessment, and they connect you with emergency services and stay on the phone with that individual until an ambulance can get there, okay? So it's a great service, it's available 24/7. So let's talk more about treatment and what that involves. So basically, when you're going to see a social worker, counselor, psychologist, we're talking about clinical therapy. And the word counseling is thrown around a whole lot. So there's all kinds of different counseling out there, career counseling, academic counseling, but what we're really looking for with mental health issues is clinical therapy and that type of counseling. So you're looking, when you're choosing somebody, you want to find someone licensed, you want to look at their theoretical background, so you want to know, are they cognitive behavioral, read up on each person and make a decision with somebody you feel comfortable with. So medication is also a form of treatment, but the disclaimer with that too is, it's not going to solve everything as well. Sometimes people get said, I just want medication from their, doctor or their therapist, and they'll see over time it doesn't solve everything. You still have to use coping strategies. So that whoever you're working with as a mental health practitioner is going to work with you on all of those things. Okay, so I want to talk about some myths in the Muslim community. These are things that I've heard a lot about over time, statements that people have made, stories that I hear, comments that I hear people make in passing, and I want to make sure I'm not misunderstood here, especially with the first one, okay? So one of the things that I hear people say is, you're depressed, it's okay, just make dua. Just make dua, it'll be okay. I'm not saying dua is not important. Dua is incredibly important. With dua, Allah subhanahu wa ta'ala can help you with anything. Of course, we know this. But again, I'm going to go back to the example of a guy with a broken leg, right? If you've just gotten yourself in a situation, like let's say somebody's in a car accident, okay? And they come out and they've broken their arm or leg. And you walk up to that person and you say, are you okay? I mean, do you want me to take you to the ambulance, take you to the hospital, take you to see a doctor? And they say, no, it's okay, I'm gonna do dua. I'm gonna do dua and it's gonna be okay. That doesn't work, right? Okay, you have to take action as well. Dua is important, dua works, it will heal you, but Allah subhanahu wa ta'ala also wants us to take action and help ourselves too. So that's the same with mental health. Take action, be an advocate for yourself, get the help that you need, in addition to making dua, in addition. Marriage will solve all the problems, okay? So sometimes I hear this, that, this sister, I know she's going through a rough time, she's got some mental health challenges, but it's okay, she'll get married and it will all be better after marriage. Going through a developmental stage of life is not going to solve the problem. Is not. And please, if you know you have a big problem, like a mental health issue that you need to deal with, the last thing you want to do is jump into a marriage or jump into a relationship with somebody else, because that's going to just make it worse. So I think that's a big myth we need to debunk, okay? Going to see a mental health professional is haram. I've heard scholars say this, even in my discussions with some other mental health counselors who are Muslim. They've said that they've come across imams that are against her, for example, this young woman practicing counseling. She's a Muslim therapist. So going to see a therapist is not haram, it's not against Islam. I think the worry and the concern there is that the therapist is going to brainwash you or take you away from Islam, and that's just not true. It just isn't, because first of all, it's against their code of ethics. They can't impose their values on you. And if you're seeing somebody who's trying to impose their values on you, you go see somebody else, you know what I mean? And you can even, if that's a concern, that you're worried they're going to take you away from your faith, go see a Muslim mental health professional. I mean, there are plenty out there. So a lot of times people feel more comfortable, having a counselor who understands Islam, who understands the importance of your faith, and that's totally fine. So do what's comfortable for you. But I think this idea that it's haram, it's just not, it's not true. Doing well academically is all that matters. So this is another misconception I see. So sometimes people think, oh, well, he's getting straight A's, she's doing wonderfully in school, so I'm not worried about her at all, I'm not worried about him at all. That's a problem too, because sometimes people are doing very well in school, but in other areas need assistance. So a good example of this is people with autism or Asperger's. People with these syndromes, they have a lot of, they're very intelligent, I mean academically very smart, but when it comes to social interaction, they lack that intelligence. So they need to be even taught skills of how to communicate effectively with others. Another myth we need to debunk too is that people just need to get over it and just stop feeling that way. So it's not that easy to just, when you're dealing with a mental health issue, just snap out of it. That's not how it works. There's actually a biological component to mental health issues. So if you look at brain scans of people with depression versus those without, the brain scans look totally different. You can see what a healthy brain looks like compared to one that's depressed. So we need to stop thinking like people can just snap out of that. And I think the last myth we need to debunk is that mental health issues or mental illness doesn't happen to religious people. This is not true. Mental health issues can affect any of us. Mental health issues don't just happen to people who are not religious. So that's important to keep in mind. Okay, so right here I have a website I wanted to share with all of you. It's www.muslimcounselors.org. So again, if you are interested or someone you know is interested in seeking counseling, you prefer to see a Muslim counselor, you have some great directories online to reach out to some individuals. So this one, even has some in this area, Abdullah Rothman. You can go on and look at his biography, and then see, get in touch with him and see if you wanted to meet with him. And look down the whole list. There's a whole bunch. There's also online counseling. So if somebody's not in your area, you would prefer to speak with a Muslim counselor, you can do counseling online now even. So another great resource is mentalhealthformuslims.com. Put a lot of great articles up, I think, related to mental health issues pertaining to Muslims. And then another one I want to put out there too is peacefulfamilies.org. They do a lot of domestic violence work in the community, and I think it's worth sharing that website and worth checking that out, because that's definitely another issue in our communities. So I always believe that prevention is the best intervention, and that's really why I love the work that I do right now. So much of what we do is event planning and doing trainings and all these awareness campaigns on campus. And one of the organizations that I advise is Active Minds. And this is a student-led organization that's all about reducing stigma around mental health issues. So if you're a college student or you're in high school or elementary school, you could get involved with Active Minds. You could start your own Active Minds organization. If you check out their website, you can get ideas for how to advocate for mental health in your community, what kinds of events you could plan, what kinds of occasions you can commemorate. So for example, National Day Without Stigma is coming up in October. So, you could do that as a youth group. You could, just be creative and look into ways to talking about this more, because I think that's really the first step of breaking down the stigma, is to actually talk about this. Another thing that's coming up is the Out of the Darkness Walk that's hosted by the American Foundation for Suicide Prevention. So that's the team of students that I took out this year to Ocean City, Maryland. Actually last year, they're doing another one this year in September. And it's great. So I mean, you could, as a youth group, organize a walk, host a mental health fair. There's so many ways to begin to talk about this issue in our community. And I just want to leave you with this quote from Imam Ali alayhi salam. صلوا على محمد وآل محمد.
اللهم صل على محمد وآل محمد.
So it says, do not let your difficulties fill you with anxiety. After all, it is only in the darkest of nights that stars shine more brightly. I think this is so important, and I think it's so relevant to what we're talking about today, is that, really, all of us are going to face challenges, and problems are temporary. I think whatever you are going through at this moment, it's really important to realize it's a temporary problem, and Allah subhanahu wa ta'ala is seeing everything. He knows what you're going through, and it's through these difficulties and challenges that we're being faced with that we begin to shine like the stars. We become even more brilliant. We begin to stand out, because who do we admire in life? We admire those speakers who come and talk about how they got through a difficult situation, how they were resilient, how they were able to come through something difficult and be successful. Aren't those the people that we admire the most in this life? What about the Ahl al-Bayt alayhim salam? What about Prophet Muhammad sallallahu alayhi wa sallam? Like what he went through during his time, what he had to overcome, what the Ahl al-Bayt went through, the oppression. We admire them for their resilience. We admire them for that. And so whatever you're going through, keep them in mind that, inshallah, you can get through it. And we, at the same time, we've got to understand that this body and this mind and this spirit is a ni'mah. It's a gift from Allah subhanahu wa ta'ala. Every day we're given as a gift. Every time we have good health, we've got to say alhamdulillah for that. And we really need to advocate for our health. We need to advocate for ourselves. There's just a lot of problems right now in our ummah. A lot of bloodshed, what's going on in Iraq, what's going on in Gaza. It's disturbing, and we need to keep ourselves mentally sound. We need to take care of ourselves, because these are the ends of times coming right now. I mean, we are in the stages of preparing for our Imam, Ajalla Ta'ala. And to be prepared for him, we need to be mentally, physically, emotionally sound. We need to take care of ourselves. We need to advocate for ourselves, so that we can better serve Allah subhanahu wa ta'ala. Okay, so that concludes my presentation, and I'll end with questions.
Sister Anisa, have you guys seen any trends, or especially, I'm more looking for a trend for related to social media? I mean, anxiety or depression coming out of social media. I mean, they've been here around for a couple of years now. Have you guys dealt with any of those sort of types of work, or maybe especially in Muslim youth?
That's an excellent question, and that's a big topic, because we do see quite a few people coming into the counseling center because of something disturbing that they wrote on Facebook. So sometimes they'll write a status, and other people will call the counseling center and say, hey, I've got a friend who just said, they're planning to kill themselves tomorrow, they're planning to end it, I mean, what should I do? So we get a lot of consultations from students who want to know how to help someone, and I think that's really important to be aware on social media, because I mean that's how we're really connecting with people these days. I mean we're doing less face-to-face connection, and so we need to be on social media, and I'm not saying we need to be on social media, but we're on there and we see a status, or we see that somebody's posting things that are disturbing, to look into that and reach out to them. There's even a way that you can report what somebody's posted, and somebody will follow up with them from the Suicide Prevention Lifeline. We'll send them a message saying if they need help, that they can call this 1-800-273-TALK. So there's that setting on there too. But we're seeing that a lot, people coming in, writing things on social media, that are disturbing. Does that answer your question?
Just to spin off from the question itself, I mean, I'm looking for, is there any trend that is coming from, like, any overall, that social media, Twitter, people being on Facebook, all of these, social media itself, like, especially the youth, have they been, like, socially distant from face-to-face connection, and it's causing them overall to be disturbed later than when they grow up in a youth, teenager-wise, or, I mean, it's not really into the norms of suicide or
Right,
anxiety
right.
itself. I mean,
Yeah, I mean, I definitely think, I mean, I haven't read a whole lot of research out there on that and the effects into, you know, adulthood
Right.
and what that has, but I think it definitely has an impact, you know, on just, you know, how people communicate these days and how that affects people. I think there's definitely more feelings of isolation, for sure, than ever before.
You commented briefly about language when you're in interactions with the people who may show signs. And if you could comment a little more on the appropriateness of not isolating the person, or maybe how to avoid escalating some event that may have occurred. If you could comment on what you have experienced.
Okay, so I think I'm trying to understand your question. So, is it that in confronting that person, you think that person might get angry, or, you know, can you elaborate more?
Well, I'm thinking that if you have a situation where maybe some of these signs are shown,
Yeah.
and you're interacting with that person, what is the best language to use with them to avoid escalating the situation, and if isolating that person, if it's possible, maybe it is, maybe it isn't, but in your experience of what you find is the best thing to do in terms of isolation, how far in do you go, or whether you stay out, what would you recommend?
I see what you're saying. Yeah, I think that's a good question. It's really case-to-case basis, because sometimes people, you know, you approach them and you say, okay, I've noticed that, you know, you seem down lately and things are, you know, is everything okay? And that person might not want to engage with you. And so I think in that situation, it doesn't hurt to ask a couple of times, you know, are you sure everything's okay? But at the end of the day, come to them in a compassionate way. You know, I think be empathetic, non-judgmental. You don't want to tell that person what to do, like, you need to do this. You don't want to use that kind of language. Like, I think you need to go to a counseling center right now. I think you have got some issues. You know, you want to come at them saying more in a passive way, like, I notice this, I'm concerned about this, and speak more about how what you're seeing, what you're observing. So speak more from the first person rather than saying you're doing this, you're doing that, you're doing that, because that can come off as kind of, I don't want to say insulting, but it almost, that person will want to isolate, I think, further and further if you come to them in that approach, but rather come to them in an approach that I'm here for you, and, you know, if you want the resources, I can go with you. So if you know, want to speak to somebody, would you like me to go with you to, you know, see that person? I mean, you can offer your help, and if they want to take it, I think it's up to them. At the end of the day, they have to be the ones to make that decision, and you can't force them to get help too if they don't want it, you know, and that's the hard part about it, is they have to really recognize what's going on. But sometimes just you coming up to them a lot of times can help them recognize that they do need help, and it just, I don't know if that helped to answer your question. Yeah. Yes.
Thank you very much for this excellent presentation. You did a marvelous job.
Oh, thank you.
I really appreciate that. You've taken the time to educate us and bring this topic to the community, and inshallah you'll do more. I want to share two significant parts too that related to the points you brought up about suicide, and also about the myths in the Muslim community, like the academic work is doing well, and so no concerns. Well, they're doing excellent. South Korea has one of the most highest achieving academic student body in the world, but also has the highest youth suicide rate in the world. If you were in Ummah with me in 2012, I had a lecture on this, but that's really, really important, and it goes along with what you shared, that academic success is not an indicator of mental health.
Yeah.
And the pressure from academic success or academic achievement, which is pretty high in our Muslim communities, in certain ethnic groups in particular, can be a huge stress for our young adults and youth today. So that's really important to keep in mind, inshallah. The other thing is, in terms of looking at signs of suicide, one of the other big indicators that suicide might be imminent is when the person who's already gone through this depression, you're seeing that decline in behavior, you're seeing the abnormal mood and affect, then all of a sudden they become euphoric or happy again. It's often a big trigger that, or actually it's a big sign that the person may have now committed to following through with the suicide. So if you see that dip and then a rise suddenly in mood again, that is actually a big red flag. Don't think that person's 100% better yet. They may have actually come to terms with committing suicide. Now, can you talk a little bit about that?
Yes, that's a really good point. So we do see that a lot too. So people right before they actually have the plan, there is, like what you said, this piece, because the anxiety part of suicide is figuring out, when am I going to do it? How am I going to do it? Maybe they're still trying to figure out how they should do it. So that's what's causing most of the anxiety for someone who's suicidal. But it's really interesting because a lot of times, people right before they actually commit the act will be living a very normal day, like almost as if, like for example, they'll fold all their clothes. They don't, they'll just go about like it's a normal day, try not to leave a mess for that person to clean up afterwards. So people think, okay, like, everything must be normal, clean the room, called all the friends, maybe they're talking to all their friends to say goodbye, So I think that's really important, what you said. And certainly, yes, I mean, Korea is a good example of, with their suicide rates, some of the issues there, that academics does not mean, good academics doesn't mean that you're not having other issues. So thanks for pointing that out.
You said that prayer helps. Am I right?
I'm sorry?
You said that prayer helps depression. So would it be correct to say that a person who is praying and suddenly stops praying? Is that a sign?
If a person who normally prays and then they stop praying, could that be a sign of depression? I mean, it could be. It could be, but I wouldn't say that's the only thing. I think you would have to look at a lot of other things too, how the person's body language is, what they've been talking about. Have they been talking a lot about death lately? So some of the other warning signs are important too, but I think it could be. And I think it's worth having a conversation with that person to explore it more and saying, I noticed you stopped praying. What's going on here? So, and asking that question directly about suicide is important.
Sister.
Thank you, sir.
Very good lecture, mashallah. I'm a family physician. I see a lot of patients with anxiety,
Mashallah.
depression, ADHD. Just have a comment for parents, because there's so much overdiagnosis of these things too at the
Yes.
same time. And most of the primary care doctors, if the persons do not go to see a specialist, they put them on some medication. And some of those medications have so much addiction potential, you cannot take them all. I see so many patients, I ask them, they have any depression or anxiety, but they are taking anxiety and depression medication. So for parents, it's very important. First, go through psychological counseling, some cognitive and behavior therapy. Second should be some more counseling, then see a psychiatrist if they recommend you to the person needs the medication.
Yeah.
Because it's very easy, people put them on medication, and then it's very hard to take off those medications. Sharing some
Yeah,
thoughts.
thank you so much for sharing that. And I think that's a big thing. The number of students we're seeing with ADHD and the number of young people being diagnosed with that, it's really incredible. A lot of times people are put on medication